Hi everyone, my name is Darlene Laessig and I'm here to talk about gender-based medicine with an interventional cardiologist. So with that being said, my targeted audience for this video are interventional cardiologists themselves, and also we'll kind of dabble a little bit into the cath lab and the staff and what they might see on a day-to-day basis from different genders and sexes, and also we'll kind of get a little bit into the transgender world. Being in South Florida, we truly are a melting pot of culture and diversity, so I feel this will really help everyone kind of get a little bit more of an understanding, and maybe we all might learn a thing or two from this little video here. So what is sex? Sounds like a great conversation to have, and you've probably had this with your kids before, but it's not about to be that fun. So it's kind of simple, actually. Sex refers to the biological differences between men and women. It's really it. It's the feel-good hormones we get in our brain. What causes depression more in women versus men? Is that even really a thing? Is it just something that's not talked about in men? So keeping it simple, sex is the biological differences between a male and a female. So then there's gender. Gender is a little more complex. It's going to get fun. Gender is roles, behaviors, and identities of girls, women, boys, and men, and also gender diverse people. Now, I'm sure some of you are thinking, what the heck does she mean by gender diverse people? So this is adding another nice little layer onto the gender platform, but gender identity isn't just that you're a woman or you're a man. Some people are born feeling that they are trapped in a body but identify as another gender that they were not assigned at birth. Some people can feel this later in life and finally be able to act on it. Some people don't have the mental support, the physical capabilities, maybe the medical support, which we are trying to change that dialogue daily within medicine, and also maybe the financial resources to transition into the gender that they feel that they truly are, not what they were given at birth. Now that really does come into what we do in the cath lab and also what you might do in your practices. It isn't always easy to separate the influences of sex and gender while you're in the practice or maybe while you're in the cath lab. So we'll kind of get a little into a hormone that's found in both sexes, but how it might affect different genders. So testosterone is a hormone that is found in both sexes. It's found higher in men and also in transsexual men. So that is women who have transitioned to becoming a male gender. This can cause aggressive behavior, which is found in high-risk seeking patients. And these are also the type of patients who maybe will neglect their own personal health more. So what does that mean for interventional cardiologists? Basically, this means you're going to have more critically ill patients coming in with STEMIs, ST elevated myocardial infarctions, which can turn into severe cardiogenic shock. These patients can end up needing heart transplants, left ventricular assist devices. They can become more critically ill due to the fact that they are neglecting their own health care and maybe not even listening to their symptoms. Also, with this hormone, we can see more cardiomyopathies. Cardiomyopathies are a weakening within the heart muscle itself. This can result from high levels of steroids and hormones. This can be found in men that are trying to improve their physiques with hormones and steroids, but this can also be seen in females who are transitioning into the male gender because of just the load of hormones, and maybe they have gone to a doctor that was just within their price point and that's what they could afford, and maybe the hormones were not given to them correctly at the times that they should. Maybe they just had a little bit of an overload. Also, with this subset of patients, women are more prone to a condition known as Takotsubo. This is kind of when the heart muscle itself just gets shocked, and it is a form of cardiomyopathy, which means the heart's not pumping the way that it should. So women who are transitioning to the male gender just from the stress, the mental aspect of it, their heart could be in shock also. So this is something that we need to consider and look at. We went from having fun talking about sex, and now we're kind of talking about mental illness and the mental aspects of this. So this took a turn very fast. With these things being said, we need to learn how to treat the biological needs of our patients, but not deny the fact that they have mental aspects that we need to take care of also. And this goes for male, female, transgender, anyone. We need to be more open to treating with passion and caring more about the mental side of cardiology. We all know that in cardiology, women are extremely undertreated. They go without their symptoms being treated sometimes for, almost a month because they think they have a backache or they've had heartburn for 2 weeks. This kind of contradicts the whole hormone theory that I was just talking about of testosterone. But it's more due to the lack of textbook symptoms that women present with. Women are notoriously sicker when they come into the cath lab or they come in for an emergency, and this can stop with the physician themselves. Educating women more about their personal health and also their gender-based medicine can actually have a huge impact on their lifestyle, but can also really save someone's life in the long run. As we previously spoke about with men, flip side here, they are more to neglect their own personal health. They are the first ones to say that I just didn't think that the pain was that bad and I did not need to come in. I had a patient one time, he told his daughter that he had been having chest pain for 2 weeks, and he finally felt like he needed to go to the hospital that night. That night, he passed away, and after an hour of cleaning up his body for his daughter to come in and say goodbye to him, it really was that bad. The pain was that bad. And we can do better. You can do better by educating these patients, educating the men more of, if you have symptoms, don't ignore it. If you're given medication, take the medication. Like, we just need to have these conversations more based on the genders that we're treating. And that's really what it comes down to. I think, just as I just said, I think and I feel that education is number one in both genders, or in any gender that you identify as. It does not have to be a binary male and female. We just need to educate our patients better on their biological needs, their mental needs, and also their physical needs. We need to educate them not only for their cardiac risk and the cardiac disease, but we need to teach them to trust their bodies. We need to tell them that if you're feeling chest pain, you need to come. For women, if you're feeling back pain that kind of radiates between your shoulder blades, you need to reach out to your physician. It's better to have an EKG versus the story that I just told. We have to stop the negative narrative within cardiology also. We need to not teach that men are wimps because they're complaining of pain, or that women complain too much, that there's no place for that within cardiology. We also need to teach women that maybe certain medications aren't right for them just because that's what their friend is taking that they play tennis with does not work for them. We need to do better of learning, does this woman have osteoporosis? Maybe I should not be giving her this blood pressure medication that can drop her blood pressure. She could fall and she could break her hip. We need to look more into what we're offering patients, and we also need to be more open to having conversations with them. It's not a huge secret that interventional cardiology is a very male-driven profession. It is what it is. We all love it. With that being said, You need to be able to have these conversations with men more openly of don't ignore your symptoms. If you're given medication, you have to take your medication. There's no excuses. So, it really comes down to us. Maybe women need a more nurturing tone due to their biological makeup and the hormones and their feel good juices, where men maybe need you to stress to them that you cannot skip this medication. If you have chest pain again, you have to come back. Sex and gender are so important as to what medications we take and how we treat our patients. We as a cardiology community can do better and we will do better for our patients.